Hi there, I'm Lewis and I'm here today at my local sexual health clinic to ask some questions and demystify some of the facts about this place, and to relieve some of the cringe we all feel when we hear the words sexual health. Let's see what they have to say. Hi there,
Hi,
I'm Lewis.
I'm Sarah Allstaff. I'm one of the consultants here.
Nice to meet you.
And you?
So, I've been tasked with asking you a few questions today to sort of demystify this place. We good to crack on?
Absolutely.
Ideal. So, let's start with the basics. What is this place and why do people come here?
So the first thing to say is that this is a really safe, confidential and a welcoming place for people who want to come to discuss their sexual health concerns. In this clinic, we specialise in reproductive healthcare, which is around providing contraception and dealing with its problems. We provide care for people experiencing sexual difficulties and also for women when they go through the menopause. But we also specialise in the treatment of sexually transmitted infections, so infections that can be passed on by sexual contact. So we can diagnose them, test for them, treat them, and also help prevent them. So the common infections that we see might be chlamydia or herpes. And some of the less common but important infections that we see include syphilis and HIV. So that's what we do here.
Now, I know there's a lot of urban myths around this, but what actually happens during an STI test?
That's a really good question. It depends what's brought you in, actually. It could be as simple as going to the toilet and doing a urine test or a swab test yourself to test for chlamydia and gonorrhea. Everyone that comes here, we recommend that they have a blood test to test for syphilis and HIV. But if you've come in with symptoms or problems that make you think you might have an infection, then it's a really good idea to let the nurse or doctor examine you so we can do additional tests, see what's wrong with you, and often treat you before you leave the room. But a lot of people find that embarrassing, and we wouldn't force anyone to have an examination if they didn't want to have one. We'd make them feel as comfortable as possible, and we'd really hate the thought of an examination put you off coming in. We'd much rather that you came in and we did what we could for you rather than that you stayed away because of that embarrassment. So really it's all in your control, and we try to make you feel as supported as possible.
Great. One of the biggest fears that people have about coming here is the thought that they're going to be judged for it. What would you say to somebody who's worried about that?
I think we could understand how that might feel when you come to the clinic, but I would want to reassure you that it's a key value of all of our staff that we treat people with the dignity and the respect that we would expect to receive ourselves. And there's very little that we hear that we've never heard before. We're not here to tell you what to do or how to live your life. We're just here to support you and give the advice and help that you need to have the positive sexual relationships that you want to be having.
That's great. So what's the deal with confidentiality? Does my GP, who also sees my mum and my gran, have to find out about it? And what happens with young people?
Okay, well, that's a really common question. What we do here is completely confidential. The system, the electronic system that we use to record your information isn't available anywhere else in the NHS. And in fact, you're identified by an anonymous number. You don't even have to give us your name if you don't want to. Actually, even our own receptionist can't access the clinical information in your files. So nobody else will be able to see what we document here. In very rare situations, we sometimes have to share information. And that would be things like if we felt that a child, a young person or a vulnerable adult might be at risk of being harmed, abused or exploited. We're legally and ethically obliged to share that information with other people, although we'd always tell somebody before we shared that information. And the same goes for young people, that young people are entitled to medical confidentiality, and we're here to ensure that young people are making safe and responsible choices and they're not being harmed. So our service is confidential and in some cases anonymous.
So why do you think there's still such a stigma around the NHS sexual health clinic?
I think it's crazy, isn't it? Because sexual health should be important to all of us, and most of us enjoy sexual relationships over the course of our lives. I think there's an idea that people who come here or what we do here is around promiscuity, or the idea that some types of sex or that some types of partners might be dirty or unclean, and these are terms we try to move away from. I think it's really important as a society that we feel more comfortable just talking about sex, but also being more positive about sex and talking as much about the very positive aspects of sexual health, including satisfaction and fulfillment and relationships. And just remembering that health is far more than the avoidance of unwanted pregnancies or infections, but it really is about healthy sexual relationships. And I think we need to talk about that more to ultimately overcome the stigma.
Yeah, definitely. Well, thank you very much. That's been really reassuring.
You're welcome.
It's great meeting you.
And you, thanks for taking the time to come and see us and to let other people know what it is that we do here.
No worries. Have a nice day.
And you. Bye-bye.
Well, one thing I've taken away from today is that the staff here are actually super friendly and approachable, and they're not here to judge you. But the main thing, I guess, would be that you don't come here because you've been irresponsible. You come because you're taking responsibility for yourself.